How are ovarian cysts affecting your chances of conceiving? Well, today we are going to look at the meaning of ovarian cysts, their causes, and how we can treat them. Welcome to the fertility series. I am Dr. Raisha, a pharmacist and a fertility and women's health expert. If you are new to this channel, please do not forget to subscribe and hit the notification bell down below. So today we are going to look at ovarian cysts. What is an ovarian cyst? Number one, ovarian, meaning it is occurring, it is developing in the ovary. Number two, cyst. So I'm going to show you a small illustration right now. So I have this. Don't worry about how I've tied this bag. So yeah, I think this is a paper bag. We can call it a paper bag filled with water. You see? And when you look at it, it is quite soft. You see? It is very soft. And you can see that it can easily rupture because this membrane is also very soft. So it can easily rupture. And that is why you can hear maybe when you go to the hospital, the doctor can tell you your cyst has ruptured because it has a very soft membrane. I hope you now get what a cyst is. So let me return that there. A cyst is a fluid-filled sac that occurs mostly in the ovaries. And most of the women, they get anxiety when you go to the hospital and you're told you have cysts. So you find most of the women panicking because now they associate it with cancer. Now this is a sign that I have cancer. No, most cysts are usually benign, meaning they are non-cancerous. And cysts can occur in a woman's body at any time of a woman's growth, from infancy to postmenopausal. Yes, so I mean that a little girl can get a cyst. They can have a cyst. And you find mostly they develop at infancy. That is when a girl is so little, a small baby, to adolescent, because that is when hormonal development is occurring the most. So, what causes cysts? Most of the times, the cause of cysts are unknown, but we have some causes such as infections. Infections maybe that are recurrent, infections that are not responding to treatment, such as pelvic inflammatory disease. Sometimes you could have pelvic inflammatory disease and you don't know. So it goes untreated for a long time. And so this could lead to the development of a cyst. Another cause of a cyst is hormonal imbalances that could occur in a woman's body. Another cause is pregnancy. Sometimes cysts are very common in pregnancy. Not all women who are pregnant get cysts, but they are common in some women when they get pregnant, and mostly they occur during early pregnancy. You find that now when the placenta develops, now the cyst usually goes away, it dissolves. Okay, but now during early pregnancy, this woman could get a cyst. And so, what are the signs and symptoms of a cyst? What are some of the indicators that could tell you that you have a cyst? Number one, abdominal or pelvic pain. You could find this woman experiencing abdominal or pelvic pain. Another thing would be severe pain. Okay, you could be feeling that this pain is very severe abdominal pain, and this could indicate maybe to a rupture of the cyst or even torsion, whereby now it tosses like this. So maybe the cyst is there, okay, then now it tosses. Okay, so that could really cause severe pain. Another sign of cyst could be irregular menses, whereby now this woman is experiencing irregular menstruation. Another thing could be abnormal vaginal bleeding, whereby you're bleeding maybe in between your periods. Another sign is pain during sexual intercourse. You could find that these women experience pain when they are having sexual intercourse. Another thing is when you have a cyst, it could be pressing on some organs, what we call pressure effect. It could be pressing on the bladder, which holds urine. It could be pressing on the bowel. It could be pressing on the rectum. And so when it presses on the bladder, you get this person urinating very frequently. Another thing, if it is pressing on the rectum, this person could have constipation. Again, cysts could also cause early puberty or early menarche. What do we mean by this? You could find that if this young lady has a cyst, now she will hit puberty earlier than what we regard as normal. Again, she could also start receiving her periods earlier than what we call normal. We find some ladies receive their menstruation maybe between the age of 10. And so you could have a young girl at the age of 8 receiving her menses, showing all the signs of adolescence. Yes, and so those are some of the signs and symptoms that people with cysts experience. How do we now go on and treat a cyst? We always say before treating, we have to do investigation. The doctor has to ascertain that this is a cyst I am treating. You just don't go treating and guess, you know what, I think this patient has a cyst. No, you have to ascertain. And how do you do that? By doing an ultrasound scan. And so after ascertaining that this person now has a cyst, we move on to treatment. We said one cause of cyst could be infection. So if this patient has a pelvic inflammatory disease, if they have an STD that is recurrent, that is untreated, we treat it. So this is whereby now we use antibiotics to treat different PIDs that this patient may be having. Again, we said hormonal imbalances could be causing the cyst. So this is whereby now the doctor will bring in combined oral contraceptives. Combined oral contraceptives are known to prevent the development of functional cysts. Okay, what if now it is not an infection, it is not hormonal imbalance, then now we can do surgery. Or yes, it could also be an infection, it could also be hormonal imbalance, but this cyst is proving to be a menace in this woman's body. This cyst is becoming very big. You could find a cyst that is 5 centimeters or even larger. Then we go ahead and do surgery. Okay, and if the treatment of a cyst will depend on various things. Number one, it will depend on the age. It will depend on the desire of this woman to get pregnant. Because if the woman is desiring maybe to get pregnant, then yes, we can remove the cyst. But we'll only do a surgery that is called cystectomy, whereby you remove only the cyst. Okay. But now, if this woman maybe is postmenopausal, or maybe this woman does not want to get pregnant, then we'll do something we call oophorecystectomy, meaning this is whereby now we remove the cyst and the ovary. And again, if this woman again does not even wish to get pregnant, we could do something called total abdominal hysterectomy. This is whereby now we remove the whole uterus. And so that is how we treat the cyst. Number one, treat the infection. Number two, if it is hormonal imbalances, use maybe combined oral contraceptives or surgery. And I have told you surgery depends on things such as the woman's age, the desire to get pregnant, and other things like that. And there you have it, guys. That is all about ovarian cysts. If you like this video, please give it a thumbs up. And if you have not subscribed, please do not forget to subscribe.